When health plans face challenges, Diversified Group provides solutions. And solutions are what you'll find when you tune in to Healthcare Uncensored Live, our podcast series that tackles the tough stuff employers are facing today. To join us, visit dgb-online.com and click on podcasts.
Good afternoon and welcome to Healthcare Uncensored Live, a podcast brought to you by Diversified Group. And I'm Brooks Goodison, president of Diversified Group, which is an independent third-party administrator of group health plans based in Marlborough, Connecticut, which is just outside of Hartford, for those of you that are not from Connecticut. The topic of today's podcast is rising costs and ways you, as the plan sponsor, can fight back. Few topics could be more worthy of our attention as you begin to plan for the new year ahead. As a backdrop for our conversation today, you may have seen that the National Business Group on Health is forecasting a 5% increase in the cost of health benefits in the coming year. After helping employers provide high-quality healthcare plans for more than 50 years, this comes as no surprise to us. Many employers have tolerated healthcare cost increases year after year for so long that they have become numb to the news. So numb, in fact, that many find a 5% cost increase acceptable, almost expected. This may sound crazy, but we encounter this reaction far more than you might expect. Far too many employers are willing to quietly accept a single-digit rate increase when there are ways to fight back, ways to take control, like self-funding the health plan, claims analysis, cost-plus pricing, and direct provider contracting, to name a few. The days of sitting back and accepting a 5% rate increase year after year as though that's the best you can expect should be over, period. So, to employers and our broker partners, we ask, what are you doing to fight rising plan costs? Let's talk about a few of the steps that we're helping employers to take action as we begin to think about 2020 and plan the year ahead. Possible solutions. The first one is self-funding. The vast majority of health plans we manage for employer groups are self-funded. In fact, more than 2/3 of workers nationwide are covered by self-funded health plans. I should really say partially self-insured because most of them have stop-loss insurance included to cap claims at a level that the plan can afford. Self-funding health benefits puts you in control and helps your plan avoid some of the fixed costs associated with traditional fully insured group plans. Fixed costs, like non-refundable premiums paid when a health plan is fully insured, premiums that include anticipated claims, a claim reserve, and insurance company profits and premium taxes that apply in most states. When health plans are self-funded, the employer's fixed costs are limited to the stop-loss premiums and administrative expenses. And then, of course, the plan is responsible for paying claims as they are incurred, up to actuarially predetermined limits. If a self-funded health plan is managed properly, savings of 10% or more is common when compared to fully insured arrangements. Another solution we're recommending to many employers is cost-plus pricing, or reference-based pricing, or metrics-based pricing. This option enables employers with self-funded health plans to replace their PPO network with a plan that limits pricing for certain medical procedures to an agreed-upon percentage above Medicare as a reimbursement level. This can make a huge difference for plan members struggling to obtain the care for their family needs. An example of how one of these plans can work for you. One couple recently found themselves confronted by a hospital that rejected their coverage, demanding an advance payment of $9,000 for their child's tonsillectomy, with a $10,000 balance due following the procedure for a total of $19,000. Because the employer had replaced their PPO network with cost-plus or reference-based pricing, we were able to work with the parents, their regular pediatrician, and ELAP services to arrange for the procedure to be performed at a nearby affiliated surgical center. Their total cost was less than $2,000, a fraction of the original price. On top of that, I knew the mom and dad and spoke to them directly on the phone, and they were as happy as can be because the procedure was a success. While a great deal of work and cooperation were required to achieve that outcome, cost plus pricing made it possible to define the pricing limits in advance by encouraging dialogue between the patient, the provider, the plan, and us as the TPA. Prior to reference-based pricing, those conversations never happened. And this is a big step in the right direction. Another way that employers are gaining greater control is through direct provider contracting. This is another option gaining in popularity. In contrast to traditional fee-for-service payment arrangements where physicians are reimbursed according to the volume of services they provide, direct primary care, or DPC, shifts the focus to value. In most of these arrangements, physicians charge a monthly, quarterly, or annual membership fee, covering all or most of the primary care services, including acute and preventive care. The fee can be paid by an individual or sponsoring organization such as an employer-sponsored healthcare plan. Patients say they enjoy a more personalized experience, including easier access, shorter wait times, and an opportunity to spend more time with their physician. Because these continuous care relationships enable the direct primary care physician to focus more on preventive care, participating physicians believe they can provide better outcomes for their patients. That's a win-win. Finally, we want to spend a minute or two on analyzing claims data, probably the most important service we provide to our self-funded clients. There's transparency in self-insurance, and access to that data can tell a story about what a plan needs to do to control costs. Our team of experts helps to mine that data and bring straightforward solutions to health plans about where their expenses are and how they control them. In contrast to fully insured plans, where employers seldom see their claims data, Diversified Group uses your claims data to manage your plan, monitor performance, and modify plan design in ways that will achieve higher quality of care and lower cost. Both of those things are possible. Analyzing claims data with state-of-the-art tools helps identify, analyze, and manage potentially high-dollar claims. This capability alone saves many of our clients more than 20% annually. Hospital stays can be monitored. Claim costs can be unbundled to detect fraud and abuse, and discounts can be negotiated without compromising the quality of the care received. Even the rising costs of specialty biotech pharmaceuticals can be managed when risks are identified early on. If you're not receiving claims data and analytics, you're operating in the dark, and it's time that you had a conversation with your broker or TPA. After self-funding, we consider analyzing claims data to be Cost Control 101. The solutions we've talked about today, self-funding, cost plus pricing, direct primary care, and analyzing claims data, are just a few of the ways Diversified Group is helping employer groups keep healthcare costs in check. Employers dedicated to providing high-quality health benefits can't just put a health plan in place and hope for the best. Today, health plans must be designed to address the needs of plan members and the overall health and wellness objectives of the organization. Self-funded health plans must be managed professionally and monitored consistently. That's what we do at Diversified Group. If your company is struggling with rising costs, please give me a call at 860-295-2376. To share this podcast with a colleague or broker, visit our website at dgb-online.com and click on podcasts. I hope you learned a little something that can help you and your health plan today, and I thank you for joining us.
To learn more about self-funding, cost-plus pricing, and many other ways Diversified Group is helping employers better manage the risks and costs of employee health care, visit us at dgb-online.com today.